Hello, friends. Welcome to homeopathy.com. We are very excited and happy to have Dr. Bipin Jain with us today. Dr. Bipin Jain is a very well-known Indian homeopath. He is a professor of homeopathic materia medica. He is the principal and director of academic services of MLDMHI Homeopathic Medical Institute at Palghar in Maharashtra. He's a very well-known academician in India, and he has also authored two books. One is on Staphysagria, the Wounded Hero, and another Marathi book called Arogya Samchikitsa Shastra. So Bipin Jain has a huge list of papers that he has published and large volume of academic and literary and scientific work that he has contributed to our system. So I welcome you, Dr. Bipin Jain, to homeopathy.com, and it's a pleasure to have you with us today.
Thank you, Dr. Manish, for inviting me. It's my pleasure to be there on your platform to share whatever experience or whatever I have gained in my life as an homeopath in Institute and in India as well. Thanks for inviting, and I welcome everyone.
So, Dr. Jain, the first thing that I would like to speak about is primarily your academic experience, especially at MLDMHI Homeopathic Medical Institute, because MLDMHI has created a standard for itself for the whole homeopathic community. We know that it's known as one of the best PG institutes for homeopaths in India. What is it that you are doing different at MLDMHI?
See, we have tried to propagate not a knowledge-based training. Long back in 1967, Dr. MLDMHI sir has started more competency-based training to the students of undergraduates and then followed by postgraduate. He was the pioneer in India to start with the integrated teaching in homeopathy. And that has paid a platform for teaching and learning for the students. Because since you know that what as a homeopath we deal and we understand the man as a whole for individualization. So any teaching program which is fragmented and not being integrated from beginning will have compartments in mind of the students. The more intelligent and more committed students, they go out and have experiences and succeed, but not many are able to then practice homeopathy from the perspective what Organon lays down. A homeopath has to develop the competencies to be an holistic healer. So what we did was we tried to integrate the teaching learning in a way so that the individual is able to perceive the man as a whole, and he understands the different component of that whole, and he is able to create a portrait by integrating all this. So the whole training program was constituted or was structured keeping Organon in center. And then all clinical subjects, the homeopathic subjects, the applied part was put in the framework of first 6 aphorisms to create a portrait. So the platform was Organon, and it was not that, you teach all the clinical subjects and at the end you apply the application of homeopathy. That is not the way you look at the holisticness as well as individualization.
So when you say that MLDMHI Institute was one of the first to introduce integrated training approach, what exactly do you mean by this integrated approach? Is it related only to the integration of homeopathic philosophy, or is it related to the integration of modern medicine and clinical training also within that paradigm?
I'll give you a very simple example. When we are, looking at our BHMS structure, as you know, the syllabus, the first BHMS deals with the man in health. Now, if I understand health from a perspective of Hahnemann and his follower who constituted concept of man, how do we understand man in health? Now, if we take up that as a platform, the bio, psycho, social, spiritual, cultural, and is able to deliver the functions, which is optimum to serve a higher purpose of life. If I understand those perspectives, then in that framework, I will try and teach student the psychological organization, the structural organization in terms of anatomy, the functional organization in terms of the physiology. And then I teach them that the man is not anatomy alone or a physiology alone or a psychology alone. It is an integration of all these three phenomena, and they work in tandem and they deliver the function if there is an harmony in a functions, and that harmony is maintained and being perceived when we understand all these components of health. So you form one habit of a student to look at the things from these holistic perspective and not alone from an anatomical or a physiological perspective. So for that matter, if you take up certain systems, like if you're taking a respiratory system, now I go to the specifics. Then what are the components which define the respiratory health? Then simultaneously, if we teach them the part of anatomy at the same time, the physiology at the same time, and then we integrate how does it constitute the health, then what are the representations of them in materia medica and the repertory? So together we are able to take them and make them think in an integrated way rather than each subject is separate, fragmented. And when they are taught at a different time frame or in a time period, then there are a lot of confusion. Then student also thinks that anatomy is independent of homeopathy, physiology is independent of homeopathy, and other subjects, even psychology is independent of homeopathy.
So that's a very unique approach where you are integrating all the systematic knowledge of modern medicine, anatomy, physiology, practice of medicine, along with homeopathic subjects. But how does this boil down clinically? Like, for example, if a patient comes to any college OPD, the standard practice is to take the case, repertorize, make a differential diagnosis in materia medica, and give the remedy to the patient. So this is the standard protocol that is probably followed in every college across India. How does the training and teaching at MLDMHI make a difference in how you approach, how a student approaches a patient, and how they deliver the results?
See, if your OPD is taken into classroom and classroom is taken back to the OPD. So each of these cases are being looked upon from a framework of a portrait. It starts from the presenting symptoms and the causations, and causation not only in terms of nosological cause or pathological causes, but it all comes in terms of biopsychosocial, cultural, whatever perspectives the aphorism number 5 delivers to understand the man. So if we are able to integrate practice of medicine with community medicine, the preventive and social medicine, and the primary concept of causation, which pathology talks of, then we train students to understand the multiple dimensions of causation. So it is not a single cause, it's a multi-dimensional causations. Then what are the possible pathological and clinico-pathological expressions vis-a-vis the individual expressions? What is what is most important when we study disease? The modern medicine classify the disease into different things. Like if you take up a simple example of rheumatoid juvenile RA, now they have a monoarthritic, polyarthritic, and systemic. From them, I mean, it is based on statistics they have classified. But when I look at from a homeopathic perspective, then these are the different expression of susceptibility. So they are the spectrum of susceptibility, in which one individual it is only one joint, and in another individual the systemic expressions also. So until we start working from these framework of evolving expressions in a patient, from a predisposition, disposition, diathesis to disease, and disease starting from a functional phase to the structural phase to the reversibility, irreversibility. And from those perspectives, if we study materia medica, because our materia medica also is full of these symptomatology, But if we systematically arrange them, then we understand our Mathematica image as similar as a patient's image, and then we are able to compare the aphorism number 6. So the whole patient's workup is done from these perspectives, and clinical diagnosis is part of it, but not the final thing, because it's just an expression of susceptibility at that given moment of time.
So MLDMHI has existed for so long, and so many people have contributed to its growth. And what have been the lessons that you have learned? You have been associated with this institute for so long. What kind of lessons you have gathered as an academician, as a researcher, which can be replicated across India to improve the quality of education in all our colleges, not just about MLDMHI, but there's because I know that not just your training and your teaching, the overall management and the structure is also very systematic, and you do focus on data gathering and learning from that also. So what is it that the group as a whole has been able to gather which can be used as inputs to other college for improving the quality of homeopathic education, training, and practice for the students?
See, now we are in a world of quality, and quality asks for standardization. Standardization does not mean that you follow the processes. Standardization means that you have got a system of collecting evidence, documenting evidence, processing evidence, and then whatever actions you take, the results are being analyzed based on those standard processes. And that is a key. See, what we lack as an homeopathic scientific world is this documentations, evidence-based medicine. Because majority of those practitioners, they may produce good results, but how, why, when, where, these are the questions when they have been asked, it becomes difficult scientifically. People don't even do the follow-up investigations or, follow-up evidence, or they don't have enough evidence for prescription, or they don't have even enough evidence for diagnosis. So whatever you claim and whatever you explore and whatever you supply to the scientific world becomes inadequate. And when it becomes inadequate, that also means that we are not able to transfer the scientific homeopathy to the next generation. Now, this in thrive of quality and standardization of these level of evidence, receiving, documenting, processing, what it amounts to that these processes trains the mind of a student. When you look at the fundamentals of training which Hahnemann has laid down about the different knowledges and the integration in terms of formulating and portrait through fifth aphorism, the case receiving. When we look at these processes, it requires an ability to receive. That's one of the quality of a physician. It also requires, the next quality is to have the analytical mindset, where you analyze the symptoms. It also requires physician to develop and a synthetic mindset, where you reintegrate those symptoms which you have classified. And then it also requires physician to develop an abstract mindset, because when we form a portrait, it is much larger than what is it. And then when we apply action, or when we take action to evaluate action also, it requires more of an analysis. So training of mind of a physician is a fundamental to produce evidence-based homeopath for generation to come. And this is a basic training, and this basic training only can come with the discipline. You can't have somebody saying that I just saw the two things and I prescribe. Yes, good, but then you create an evidence, and also you convince people. You can be a master prescriber and a practitioner and a person who is result orienting, but you are not helping the next generation. So we need to lay down a standard processes of these, which will have a standardized way of presentations, of teaching, of education. And these all things can only be done in a hospital, OPD, IPD, or community. And when these experiences are taken back to the classroom, it trains the mind. It connects to the theory. Our problem is that theory and practice, they are two separate entities as being practiced and as being, projected, but they are not. Until there is an harmony between and synchrony between both of them, I think we are not going to help this generation and generation to come in our thirst to improve homeopathy as a scientific science. Few groups, few people who are into it in scientifically, they are thriving. But we as a homeopathic community, we are not, thriving now. We had a very, very important example. If you take during COVID, we all were struggling to prove that ours is a scientific science and we can definitely help the community all around. But there was no one to believe us. I mean, so we need to create that level of evidence at all the level, which are standard, which are verifiable, which can be replicable. Then probably we will be able to establish what Hanuman was trying to establish, a scientific homeopathy.
So there is another school of thought within homeopathy which says that homeopathy is a very artistic system of medicine. And people like Ken, Bonigerson, Herring, Allen, Lippi, the stalwarts of homeopathy, they did not follow any standardization, and they were the ones who contributed the most to homeopathy. So how do we balance this artistic aspect of homeopathy along with the standardization that is required by the modern systems, modern society today?
I think probably this is a misconception. If you look at Kant's philosophy and Kant's Mathematica, he has definitely followed a system. If you read any remedy, there is a system in which how he has described the remedy. He has started with mentals, he has then elaborated on generals, and then he has applied those generals to the particulars. Each of them had got their own philosophy and their own standard way of prescribing. And they have followed a conscious analytical methods. Bonigerson had his own analytical method, which is, you can find in his repertory and therapeutic pocketbook. There is a standard laid down procedures. He has created the repertory based on those concepts. Same thing is valid for this. Now you go to the Herring guiding symptom, the schematic way in which he has presented his Mathematica speaks about the philosophy which he followed, the system, which he followed, the documentations and the evidence which they followed. Now, what is artistic in this is final synthesis. How you create a final image where the individual physician's quality, experience, and training takes place. So, homeopathy is science and art both from these perspectives. But all of them have followed definite system, definite concepts, definite philosophy. And they are still, applicable in different cases. So now the current generation have to explore and understand, because all of them have worked based on concept of generalization, concept of individualization, concepts of mind to body. You look at, their structures, the way repertories are being formed, or the way their Mathematica is formed. And they also have applied generalization in terms of specific. Now, there is a difference between Kant and Bonigerson. They've used an approach that's all right. I mean, that's a healthy difference. But both of them are applicable in different cases. So we need to integrate all them and also individualize their approach based on cases, rather than, following one, because all of them had developed those approaches based on their clinical experiences. So you can't defy them, or you can't say that they are not applicable, but we need to understand which are the cases most suitable for different approaches.
And would you say the same for all the modern approaches?
Absolutely. If there are evidence-based, if they are structured, and if they are able to demonstrate that, why not? But not in one or two cases. All of these people have demonstrated this with number of cases. the current approach is really what you say is, misguiding, that you have seen one case and you project the image of that mathematica or that approach, and then you try and take away that. If you want to understand an image of a certain remedy, I mean, there are 20, 25, 30 cases which are being analyzed and being projected. Then, I mean, anything which has got action result complex. I take action, I take result. I document my evidence for taking actions, and I have got my analysis of evaluating results. And if that is undisputed, I mean, we need to look into all of them. Why reject something which is so useful? That is why homeopathy is so integrative. Provided we are on the ground and we are being guided by Hahnemannian principle with the law of similar and individualization.
So I have got two related questions in my mind coming up. One is, when you are teaching within your institute and also at ML Shah Homeopathic Medical College, are you open to all these different approaches by different authors, or do you restrict the teaching to the specific philosophy related to Dr. Dhawale's? Your school itself has a set approach. So is most of the teaching revolving around that approach, or is it very open and pragmatic, including all the different authors and approaches?
I think there is a misconception about Dr. Dhawale's approach. From beginning itself, it is integrative. Students have been taught Kantian approach, Boger's approach, Boger-Bonninghausen's approach, keynote approach, and we have got structuralization. So fundamentally, when we look at the basic structure of any case, the mind and the qualified mind, now there are offshoot schools from Kant who have taken up things, or there are offshoot schools from different approaches. But fundamentally, there is nothing called ICR approach in that sense, quoted. Because our case paper, they guide you when you record the case. The case guides you whether it has got qualified mind. Not all the cases will give you qualified mind. Not all the cases will give you qualified pathology, or not all the cases will give you qualified modalities or a causative mechanisms. So whichever case dominate whichever area, and you are sure of their qualification as well as characteristicness, you follow that approach. So there's nothing called, what is ICR approach is a standardized way of recording, of receiving and recording evidence, processing those evidence, and then try and find out on an individual basis that which patient requires which approach, the Kant approach, the Boger approach, the Bonninghausen approach, the keynote approach. So we are not averse to any approach. It's that you stand on ground, you follow the fundamentals of receiving case, analyzing and classifying symptoms, evaluate the symptoms, create a totality, follow whichever approach you follow, do repertorization. After repertorization, you go back and do the basic differentiation at a different level, and then go to mathematica and differentiate. So I don't think, it is a very distinct approach from the world around. It is what Hahnemann has propagated, and it is being put in. So there's an absolute misconception about MLD approach, or there's something called ICR approach. No, the MLD sir has propagated, again I am saying, the standardized way of receiving, documenting, processing, take the action, do the analysis, get the feedback, and improve your cycle again, the receiving, processing. So through this cycle, the feedback, you go on improving your own quality, and you become your own observer of your own practice.
But the postgraduate research is not just about following a particular method, a systematic approach. It is also about exploring the areas which are uncharted or which are less proven. So if some of your PGRs come to you and ask you for permission to do research following a particular method which is less proven or less standardized according to the ICR's protocol, as per the ICR's protocol, it could be Sankaran's approach, or it could be Segal's approach, or it could be use of Scholten's approach. in a particular series of cases to see whether that approach is giving equivalent results or not. This is kind of research to evaluate newer theories, newer approaches, newer medicines. So do you provide that kind of openness within
There
that
is no,
institutional training?
see, all the research primarily requires a standardized way of recording. Whatever may be, they also have their own way of recording the things, but they do not differ. So mind and body, both are considered at the end. Because if you look at all this, they don't prescribe on 1 or 2 symptoms.
Yes.
Yes, they have got their own system of putting down. And then they have their own way of matching with things. Now, research, there are 2 ways in research done on the methods of prescribing or research done to evolve a mathematical image. If you want to evolve a mathematical image, and if my student is confident enough that, okay, I will get 50 cases of this remedy and I want to do it, go ahead, we have no problem. Because at the end, they have to complete their statutory needs. If they are now approaching the system which they are following, then we need to have a guide who will be able to guide them. If I don't have a guide to guide them, then it becomes difficult for the statutory needs. Now, those things can be taken up at a PhD level if they want to explore and they want to do it. I mean, anything which is scientific, which is evidence-based, why should a scientific institute object to it?
Very, very reasonable. It makes a lot of sense that you ought to have some good guides within the institute to actually guide the students for research in those areas. Makes a lot of sense, Dr. Jain. Another related aspect that keeps coming to my mind, and we had a discussion also when we met recently in Kolkata, is about the syllabus that is there for undergraduate students and even for postgraduate students prescribed earlier by CCH and now by NCH. Do you feel that the current curriculum fulfills the need for a modern scientific education system for homeopathy? What are the deficits, in your opinion, which are present in the current curriculum, and what remedial measures or what changes you would want to see in the future curriculums, future syllabi to address those deficits?
You see, when you look at the preamble and the writings of 2002 MSc, that is called Minimum Standard of Education, there were standard ways and means were laid down, and they have put down what is the process and what are the outcomes. The problem even at that time was to, having a know-how, how to create a structure and how to deliver a function. So, I mean, and that is true for all our, not only the homeopathy, it was true for even medical Ayurveda or even, non-medical courses. And that's why the national education policy, which have come up in 2020 by the central government, the government of India, has shifted the focus from a knowledge-based to competency-based education. You may have knowledge, but if you're not able to deliver, has no meaning. But if you have a competency, knowledge is a part of it. So if you are able to take case, you know how to take the case is one thing. But are you able to take the case in a real situation is the next thing. So, the shifting the focus on these competencies of a physician is must. And the only way this can be done is to develop all these competencies. And these competencies only can be developed if we adopt modern education technologies in teaching and learning. So if you want to adapt those medicine, you need to have a curriculum which will, take you to those competencies. So recently, the NCH has taken a move towards it. They have published for the public opinion the course curriculum, which definitely is a step towards, these integrated teaching, learning and developing competencies in a student, so that at the end of 5.5 years, any homeopathy graduates, any stakeholders will at least be confident to say that, okay, after 5.5 years, at least these are the minimum competencies a homeopathy graduate will have, which today we are not able to swear and say. We start from which college, what is it, what has, how many. So those paradigm shift from knowing 10 things or having a competency to deliver those 10 things. So now the NCH has taken a course curriculum, and now they are in the process of creating competency-based dynamic curriculum, which will take care of these competencies. And they also will devise methods of assessment, which will certify that, yes, these competencies are there. So you need to have a curriculum, you need to have a teaching learning methods and proportionate same assessment methods. Then only we will be able to deliver, and we will be able to swear and say that, okay, after 5.5 years, the homeopathic graduate will have these competencies, and which can be employable or who can serve the community at these level of competencies. So the previous curriculum did have some aspects of it, but there was a lack of intent and the resources to deliver it on a ground level. Now NCH is trying to create a structure, trying to generate resources, and trying to monitor, will possibly monitor the outcome out of it. So we are now moving in a path where we will be able to say that, okay, we are now working towards the modern education technology processes, and we are able to train mind and the people or the students to acquire competencies rather than acquiring knowledge and passing the exam. But passing the exam is not the key. Developing competency is the core. And you will agree that most of our graduates, after passing out, they need to find out some mentor or some school of thoughts and go there and then take training for 2-3 years. But then they get restricted in those thought processes, and they lack then open-minded. Like you ask me questions, like your students you allow or you don't allow. I mean, we need to develop that open-mindedness so that the students independently able to develop an ability to think, to feel, to behave, to get the feedback, and go on a self-learning cycle and become lifelong learners.
Very true. But how do you see us as a community addressing the deficit in the area of clinical training? Because what I have seen across India is that the requirement set by NCH for the number of OPD cases and number of IPD cases is higher than what we actually see on the ground for most institutes. That means there is a deficit for the number of the patient-student ratio is not proper. Sometimes we are not seeing enough, we do not have enough patients in OPD so that students get enough clinical training to develop that competency. To have the structure is one thing, to develop competency, but at the end of the day, we need patients within those OPDs and IPDs so that the students can develop the competency. How do you see that the community can address this shortfall? Why do we not have enough patients in majority of college OPDs and IPDs?
So there are 3 things which one has to look at it. One is to develop a competent resources and the faculty who is able to deliver. We have to work towards our own faculty to train them to deliver the things. Second thing is we need to communicate and educate the community that how does and where does and homeopathy works. And that is where our scientific writing, publishing, and marketing, that in what conditions and how homeopathy works, and get the feedback from the community, and then create that awareness, which again will be very useful. And the third and most important thing is we have to create a structure in our OPDs, which will be able to deliver the type of functioning required. I mean, there are resources or the structures are not there, the OPDs are not functioning. There is no intent to increase OPDs in that sense, because the importance of clinical training, it's there, but it's not established at that level, nor it is being supervised. And the whole, again, I'm saying the problem is threefold. So we have to work at that level and again create an evidence. Until you have a very standardized way, we all as an homeopathic community start documenting our cases in a very, very standardized way. You may follow any approach, that's not the issue. But there has to be a standard evidence. Nobody can say that I saw 2 mental symptoms and I have not investigated the patient, and then patient was all right, and the post investigation also is not there. You see, then nobody believes you that you are talking in air. No, patient was much better. That doesn't make sense. So, if we want to establish ourselves, then we have to follow the processes, which scientific committee and community as a whole will acknowledge that, yes, what I am saying is authentic and it's not fabricated.
You raise a very, very important, pertinent point that to improve the clinical training and the outcomes that we have at OPD and IPD and for the students, we need to have competent faculty first. Now we already have a lot of faculty in all colleges. How do you see and what steps do you envision that we need to take, the educationists, the policy makers need to take to ensure that the faculty that is already existing in our colleges is competent enough or is retrained to deliver the kind of results or the vision that we have for the future of homeopathic education in this country?
See, a while ago, we were talking about integrated teaching. Now you visualize an anatomy teacher is not sitting in OPD, doesn't practice homeopathy. I mean, I'm just creating a scenario. I'm not saying that it is true or not true. I will not comment on that. And if he is being asked to deliver a lecture on anatomy, how on the earth he's going to connect anatomy to materia medica, anatomy to repertory, anatomy to understand the final image of the individual, and from those perspectives even connect to Boger. So, I mean, all faculty who are connected with the homeopathic colleges has to be made compulsory to attend OPD, the list, and they should be put to deliver results and give statistics at the end of. So their performance appraisal should not alone, the student satisfaction survey about their teaching of anatomy, but also their delivery of results in OPD. If this happens, each faculty is being forced, and people who are not has to be trained by the faculty who are experts, teacher and practitioners, until each of our faculty understands homeopathy from all dimensions and start practicing and demonstrating results in OPD. I don't see a major, few of the practitioners or few of the senior teacher coming and sitting in OPD and delivering result is not the solution. Collectively, all the teachers, even forensic medicine teacher, why not? If he is on homeopathy, should go. He can relate toxicology with materia medica, with the symptoms, which, So there are a lot of ways in which homeopathy can be taught by a different teacher who is a practitioner. And then you can integrate all those subjects and student will understand the relevance of each subject. By the time you go into second year, they forget anatomy, physiology. By the time you go to the fourth year, pathology is out of mind. So then what remains is a materia medica symptom, and you go on trying to match them symptoms. So few times you succeed, few times you don't succeed, and that is how you practice. And then you blame homeopathy that it doesn't work.
Very true. Very true. And there is a proposal for an exits exam for the students and another exam for the teachers before they start teaching. Do you feel that these exams, the exit exam for the students and the entrance exam for the teachers, are they going to uh, take us in the right direction, that so that we can ensure that the quality is coming out from the institutes and quality teachers are getting into the institutes?
See, one benefit of an exit, standard exit exam for all the graduates will be that each colleges will have to ensure whatever curriculum is set has delivered. You can't have individual college has got his own say. So that will improve definitely the teaching, learning resources in each colleges, because they will have to teach us, because you can't have exit exam just like that. Provided we have a quality system in exit exam. Because if you have just a recall or remember type of exam, then it is just a knowledge-based exam. You need to have a problem-based and scenario-based exam, which will test their different qualities, that, okay, in this problems or this scenario, how are you going to find a solution? So if that type of exam happens, then probably colleges will have no say, because there won't be any standardized MCQ book which will, give the solutions. So I mean that's how it has to be looked upon as, and not just any other MCQ based exam which has got all recall, remember. So you sit back and you memorize everything and you vomit out and things are done. So we'll have to have that quality. Now, a lot of this teacher entrance are more in terms of research aptitude exams. They are not homeopathic exams primarily. If you look at those NTS exams and all that, they are more general knowledge and research aptitude and the teaching possible methods. So they are essential because number one, I mean, they will ensure that at least you have got an insight for future exploration in an area or in a subject in which you are going to teach. If you don't have growth mindset and exploration type of mindset, how are you going to inculcate that into students' mind? That is most essential part of it. And then you also being well-read and being aware of what is going around. That also helps in growing your faculty of mind, and which will definitely help in your mentoring and guiding students. So both of these are definitely going to help, provided we have a sound structure and a proper methodology, which will ensure that the objectives with which these exams are being taken have been achieved.
Very well said. Very well said. One last question, Dr. Bipin Jain, that comes to my mind is that when the recent sample syllabus was published for opinions, and opinions were sought regarding that recent syllabus, some hue and cry was made regarding the addition of allopathic pharmacology to the homeopathic syllabus. Can you shed some light, because I know you have been involved in this thought process? Can you shed some light why this addition has been proposed and what is the intent for it?
See, whether you like it or you don't like it, majority of patients who are chronic, they come to us with the big file. They are on a lifelong therapies, which are, antihypertensives or hypoglycemic or anti-epileptic, or there are number of drugs which are being prescribed. Number one, as a homeopath, whether do we have insight about their action, about their side effects, and what are the drug diseases we are dealing with? That's the most important part, and how they are being, regulated. So if we have got an insight into it, while taking a case, we understand that, okay, these diseases are controlled with these disease drugs. These drugs have got central or a peripheral effect. They are known to cause these side effects, and they are known to have these drug diseases. We are much better placed to understand individualization, differentiate between the drug disease and the actual disease, the alterations or the deviations in the original unmodified picture. So there are a lot of things which an homeopath needs to understand. This is from the perspective of formulating totality and prescribing. The other perspective is when they are on a drug and when you start the giving homeopathy, and when you see that there is an alteration, there is a change, and there is a need to reduce those drugs. So, at an appropriate time, you can refer it to a person who has prescribed, and you can always say that this is where I need that you please help me to reduce them. It's not for prescription. It's making a patient gradually getting free of all those toxic chemical drugs. So if both the perspectives, if you don't have the background of their chemical structure, their sphere of action, their side effects, and what happens if you suddenly remove them. Now, I have got an experience, a lot of people, I mean, there are a couple of experiences in which the patient was on heavy anti-epileptic drug. A homeopath stops everything, and the next day the patient goes into coma. These in a fanatic perspective that homeopathy, this does not, and this has to be done, and everything has to be stopped. It damages not only the patients and its outcome, it damages the homeopathy as a whole, and our image as an homeopath, it get tarnished because of these happenings. So some insight into what is a popular pathy, which is being used by majority of population in a majority of conditions. And when they report, the chronic cases report to us, majority of them are either on these regular treatments or on and off treatments. So we are able to understand person in a much better way, and we are in a better position to reduce whenever is asked under the guidance of the physician who has prescribed. It is not being probably included, and it is being really stated there that it is not there for prescribing. You are not entitled to prescribe those drugs, number one. And there is no practical training. It has only got a theoretical lectures to give you insight. So it does not prescribe you to become an allopath or prescribe allopathic medicines.
This also makes sense because Hahnemann also said that iatrogenic diseases are one of the most difficult diseases to treat. And he also says that you cannot treat a chronic disease till you remove the cause. So if the allopathic medicines are themselves becoming a cause for the chronic complex diseases that the patients are coming to us with, we do need that knowledge to find out what is causing these set of symptoms and whether these drugs can be withdrawn safely or not. So it's a very pragmatic approach, a very practical approach to the actual patients that we see day in and day out in our clinics and in OPDs. So this is this has been a very insightful discussion with you, Dr. Bipin Jain. Is there something else that you would like to add?
I think we have touched almost all the issues which are pertaining to the current education. And also I have shared my view that how do we look at the whole thing. And some misunderstanding about, Dr. Dowley's approach. There is nothing called Dr. Dowley's approach. It's a standardized approach. Again, I'm reiterating of receiving, documenting, processing, taking actions, taking feedback, and learning by self and learning by doing is what the philosophy on which our institute works. So, I mean, there is nothing different. And Dr. Dowley sir has tried to incorporate all standardized approaches which were followed by Master and his followers. Specifically, Kind, Boger, and Boningason are being integrated in very well in our methods on processing which we are following. So it's not a unique singular way. It's the processes are being laid down to train the mind. See, the focus is on training a mind of a physician. Once your mind is trained, you can discriminate, and then you can practice. You are free bird. You can fly anywhere. You can land anywhere safely.
True. It's very true. We do not need a few stars here and there in homeopathy. We need every homeopath to be a star. And we need processes and systems and right training to develop every homeopath into a star homeopath. And I really like this approach. It has been wonderful having this conversation with you, Dr. Bipin Jain. And I really wish and I really hope that every college in India learns from what you have gathered, the kind of approach, the kind of systemization that you have developed in your institute. And there's so much that we can learn from each other, and especially from the pioneer institutes like MLDMHI. So I really hope that the students listening to this and the teachers listening to this conversation are able to take home something very useful from this conversation on how they can become better homeopaths, better students, better teachers, and what kind of changes we need at a system level, at institute level, so that we do deliver a system of medicine that addresses not just the present needs, but also the future needs.
Thank you so much. It was really good talking to you. It was very insightful questions which were there, which allowed me also to reflect back and put them in our perspectives and whatever experience we have received. Thank you so much for being, here and discussing these issues with you, which are so pertinent and so open, and as well as so important in a current scenario and for the future of homeopathy. Thank you so much.
Thank you so much, Dr. Bipin Jain.